Hi everyone, this is Mr. Matus, and for today I'll be discussing to you two conditions which are found in patients with diabetes mellitus. So I'll be discussing to you DKA, which stands for diabetic ketoacidosis, while HHNK stands for hyperglycemic hyperosmolar non-ketotic syndrome. So both of these conditions are usually found in patients with diabetes and is a source of confusion among nurses in terms of the signs and symptoms. So what I'll be discussing will be the differences in terms of assessment findings between DKA and HHNK. So this is just going to be a very quick review. So let's proceed and discuss this topic. So as what I have said, DKA stands for diabetic ketoacidosis, while HHNK stands for hyperglycemic hyperosmolar non-ketotic syndrome. So both of these conditions are found in patients with diabetes mellitus, but your DKA is more commonly occurring compared to HHNK. So HHNK is kind of like a rare form of complications in diabetes. Now let's compare the two. Your DKA is usually found or occurs in patients with type 1 diabetes mellitus. And the reason is for that is because type 1 diabetes mellitus patients, if you can remember, they have absolutely no insulin in the body, and that leads to this complication, which I will explain later on. Now your HHNK usually happens in patients with type 2 diabetes mellitus, and if you can remember, your type 2 diabetes mellitus is characterized by the lack of insulin. So there is still circulating insulin in type 2 diabetes, while in type 1 there's absolutely no insulin. Here you only have a lack of insulin or decreased number of insulin production. Now for your DKA, it's characterized by hyperglycemia, and the reason for that is because the glucose is unable to enter the cell, so it stays in the blood. So the blood sugar goes up. In HHNK, it's also characterized by hyperglycemia. So both of these conditions are present in DKA and HHNK. Both of them have hyperglycemia, although your hyperglycemia is much higher in HHNK. In DKA, this is characterized by ketosis, and the reason for that is because the absolute lack of insulin leads to the conversion of fats and proteins into glucose. And we all know that when we convert the fats into glucose, a waste product of that would be ketones. And ketones are considered to be acids. So with the acidic nature of ketones, it leads to the patient developing ketosis. And that even leads to the depression of the brain, or it leads to a diabetic coma. Your HHNK is not characterized by ketosis, and the reason for that is because there is still circulating insulin and the body still is able to use glucose to some extent. So that's the reason why the body is not converting your fats and proteins to glucose, because of the some insulin circulating in the body. So that's the reason why in HHNK there is no ketosis. Now, in DKA, you could find metabolic acidosis because, as what we have said, ketones are acidic in nature, and it leads to a change in the pH, which leads to metabolic acidosis. HHNK, due to the fact that there is no ketosis, the pH will not change, so usually that is normal. In DKA, the patient will be manifesting Kussmaul's breathing, and Kussmaul's breathing is deep and labored breathing. And the reason for the Kussmaul's breathing in patients with DKA is to release the excessive acids in the body by exhaling carbon dioxide. So the patient usually, when he is in the emergency room having a DKA, a common manifestation of the patient will be having acousmal breathing, which is a deep, rapid, labored respiration. Now, in HHNK, the patient usually doesn't have a change in respiration because there is no ketosis, there is no metabolic acidosis, so there is no possibility of having a change in respiration to compensate for any acid-base imbalance. DKA, because of the ketones or ketosis, that leads to the patient having a fruity acetone breath. Now in HHNK, there is no characteristic change in the smell of the patient's breath. In DKA, it's characterized by polyuria, and we go back to the cause of polyuria will be the hyperglycemia. With hyperglycemia, that increases the osmotic pressure that leads to an increase in urination. In HHNK, it's also characterized by polyuria because there is hyperglycemia in this condition, and whenever there is hyperglycemia, that leads to increased osmotic pressure, and that leads also to increased urination. Although in HHNK, you have to remember that this patient has a very high blood sugar that leads to more increase in the osmotic pressure. And lastly, for DKA, is characterized by fever. Now, why is fever developing in patients with DKA? The reason for that is because of the presence of dehydration. So when the patient has polyuria, that results into increased urination that leads to the patient developing dehydration. And one of the manifestations of dehydration is an increase in the body temperature, which is your fever. Now, what happens in HHNK? In HHNK, the same thing happens. The patient will be having fever because the patient is having hyperglycemia and increased urination that leads to the patient having dehydration. So this is the main picture of both your DKA and HHNK on how they are different from one another. Now, if you're going to ask me what's the intervention for both of this, so definitely the intervention will be to focus on reducing the blood sugar because they are so high. So we will be giving the patient regular insulin to lower down the blood sugar. And also, one very important aspect of medical intervention is to provide the patient fluid replacement because the patient is in a state of dehydration. So this is it, everyone, the comparison between your DKA and HHNK, and I hope that when you take your NCLEX, you'll be able to identify in the clinical scenario if the patient is having DKA or HHNK, and remember that your nursing intervention will be slightly different between DKA and HHNK. All right, so thank you very much, everyone. So please click share or like my presentation or subscribe to my YouTube channel if you like my YouTube videos. And you could also visit my website at www.matusnursingReview.com. Thank you very much, everyone.